Hi, this is Chandler, and the topic that I chose for my crisis communication plan for this semester is the current American opioid crisis. So, just a little bit of background about the crisis itself. By definition, opioids are drugs that are synthetically made in a lab and they bind to the opioid receptors in the body. That's basically used to treat acute or chronic pain. And some examples of these could be fentanyl, Vicodin, and OxyContin. Those are some of the bigger players, more the stronger opioids, but these can even be drugs as common as morphine, methadone, and hydrocodone. They were developed back in the mid to late 1990s for pain management, and the original thought was that these were going to be pretty safe to use. They were really high powered, very effective. They were illegal, and they were originally thought to have no addictive properties whatsoever. So when the pharmaceutical industry gave medical professionals basically the all clear that these were okay to prescribe, they did so in tenfold. And these are used to treat acute pain, or they're prescribed to people after they're out of pretty big time surgeries, and a lot of veterans actually were prescribed these after they had returned from service, like in combat situations and that kind of thing. Fast forward a few years, and that idea has been completely debunked. Opioids are actually very, very addictive drugs. And once these people no longer had access to the legal opioids, or they couldn't afford it, or they could no longer get the prescription, they turned to the next alternative, which would either be illegal use of prescription drugs, or even more popular is illegal drug use in general. And that drug is primarily heroin, would be the street version of an opioid. And this also increased rates of other related diseases, such as hepatitis C and HIV. And those increased because they are spread person to person, mainly through intravenous drug use, shared needles, that kind of idea, which is the most common way that people use heroin. So the risk assessment here, I wanted to kind of look at this through more of a public health angle instead of a law enforcement angle. There have been some research and stories and articles that have come out even just in the past couple of weeks about how these communities that are most affected by this crisis, when they take a more kind of a public health or even mental health or holistic approach to this, the results are actually pretty great, and has led to a lot fewer deaths, a lot fewer overdoses. So that was kind of the angle that I wanted to take here. And some of the factors here that I wanted to focus on were what regions were most affected, what were the demographics that were most affected, what other diseases should we look out for from this crisis, where are the drugs coming from, who are they coming from, and what new approaches need to be taken. So like, what have we been doing so far, what's working, what's not, and how can we adjust from there. The biggest kind of roadblock that I saw with this is that it's not just a single incident crisis. It's not one data breach or one oil spill like we had talked about in class. This is an ongoing thing. It's affecting thousands and thousands of people in thousands of communities all across the nation. So it's kind of hard to hone on to like one reason or one incident that did this. So that was kind of the biggest struggle that I had doing this research. And at the bottom there, it's a pretty general graphic, but it kind of shows the demographic breakdown of who is most affected. This, I believe, is the percentage of Americans that are overdosing, and their races. So it's 78% white to 12% Hispanic black non-Hispanic, and 8% Hispanic. So some of the challenges that I faced here, like I said, was just pinpointing a direct cause, because, there are so many ways people are getting these drugs and taking them, or just kind of the relationships that they have with other people. And then also stopping the transport and sale of illegal opioids. It's this again is kind of hard to narrow down exactly where they're coming from, who's making it, where they're coming from, when, at what points, stuff like that. Another challenge would be revising basically the entire medical industry's protocol on opioid use. It has kind of changed here recently, given that we know now how addictive that it can be. But I think there's some more action that can and needs to be taken. Another challenge, too, would be increasing the public knowledge of opioid use and misuse in some of those most heavily affected communities. The communities that are most affected by this are white, low-income communities without secondary education. So that's kind of hard when you want to explain like the science and the medical background of it and kind of the legalities of it to people that aren't really kind of aware of these things to begin with or can't really conceptualize a lot of it. So that would be kind of one of the bigger challenges, I think, is just getting people on board and really understanding how dangerous these drugs are. And then the last challenge was communicating the crisis and crisis response effectively to all of the audiences or publics that we need to. On the flip side, though, some of the opportunities that I see here is that we get to educate the American people about opioid misuse and the risks involved. That's something that we look forward to, just getting more people on board, more aware. And we also want to advocate and hopefully develop new techniques for pain management, and that includes new medications for pain management. We kind of want to make opioid use the last option that people go to for treating acute pain or post-surgery pain or anything like that. We also want to establish newer and more relevant guidelines for opioid prescriptions. That kind of goes back to that revising the medical industry's protocol. That could be more detailed guidelines or signs to look for, or even taking more account into a person's family history, any histories of addiction or mental health history. We want to develop more well-rounded approaches to addiction treatment. Those two kind of go along together. Basically make it a little bit more inviting, a little bit less judgmental, and a little bit less preachy. We want people to feel comfortable. Addiction is a really tough thing for people to go through. So if they feel, vindicated for it or feel condescended about it, they're less likely to seek that kind of treatment. We want to help enact new laws regarding opioid transfer, sale, and prescriptions, and try to decrease the likelihood of those related diseases, HIV and hepatitis C, like I mentioned before, being the two big ones. So our response in general is to increase protections and resources at the southern border entry points where a lot of these illegal opioids are being transported through. They're mainly developed in South America, but then trucked up through Mexico and coming into the country mostly through legal points of entry. So the more protection and resources we can get down at those places, the better. Revise policy and guidelines for medical professionals, like I've touched on before. We want to reformat drug addiction treatment and make it more comprehensive. We want to implement safe drop-off receptacles for opioid medications and other opioid paraphernalias, and even have periodic opioid disposal opportunities along with law enforcement and public health facilities or officials. I kind of got inspired by that, learning a little bit about the gun violence crisis going on in inner city communities. They have kind of like rallies or community events where people can come and drop off any firearms that are registered or not registered. No questions asked. Law enforcement takes them, and they also learn a little bit more about it. So I think if we kind of take that stigma away of you have opioids on you currently, or you have this illegally, it can kind of open up a lot of people's eyes and encourage more people to kind of get rid of that stuff that they may already have. And that seemed to work pretty well. And then also fund new research for development of new pain management techniques and pain management medications. the key message that we want to convey is get the public to understand how serious this crisis is, but also maintain the position that we are hopeful that these new resources and programs will reduce the number of opioid deaths, overdoses, and opioid-related incarcerations nationally. The media response here, the three main publics that we're going to be addressing mostly are the media itself, the general public, and any stakeholders, and that includes like the medical industry, pharmaceutical industry, law enforcement, first responders, that kind of a thing. So when communicating with the media, the four big guidelines that we want to follow is to be knowledgeable of the crisis, kind of where it's been, where it's at, where we're planning on going. Be knowledgeable of any policy. HIPAA is probably going to be one of the bigger things involved, but also any law enforcement or public health policies that we may not be aware of going forward. We also want to stay on message. There's a lot of different ways that this crisis can kind of go, especially given some of the more like offshoot diseases like the hepatitis and the HIV. Those are causes that are obviously very important and deserve a lot of attention and, time, and they deserve to be shined on in their own ways. But the opioid crisis is our main focus here, and we don't want to conflate that with anything else. And then, of course, lastly, we want to communicate truthfully and clearly about the status of the crisis, what we're doing, where we're at, and where we see it going next. Some of the questions that I feel like we could be asked, given at, press conferences or different stuff like that would be what populations is it affecting and why those populations? How are these drugs so accessible and where are we getting them from? Why is it a predominantly white crisis that's happening? And is that why it's getting so much more attention from lawmakers and the media itself, as opposed to, maybe the crack cocaine epidemic or the HIV epidemic when those two were kind of in their heyday, as they, affected Black communities and the gay communities? Like, is that why we're giving more attention now, is because it's a predominantly white issue that's going on? And then also, what can the community do to help? It's kind of human nature for people to, see things like this that are kind of crazy and scary and want to jump in and do their part. So I think if we can include some calls to action to the community about what they can do, where they can get resources, where they can help, how they can help, their neighbors and anyone else that may be affected, would be a really good message to kind of convey also. And the press release template, I included that in the overall crisis plan, but my 3 goals were that was kind of created as a baseline press release that we can use to communicate with the media, the general public, and stakeholders. And I wanted to make sure that it stays on topic, but also give good basic background information while explaining where the initiative is at and what to expect from it going forward. And I wanted to make it kind of pliable. I wanted to make it easily adjustable depending on the audience that we're talking to and also what media outlet you're using. You're going to kind of address maybe a small town hall. You're going to address that audience a little bit different than if you were doing a press conference about the crisis on CNN. But I wanted to make that press release kind of something that you could take in any of those directions. And those are my sources. They kind of copied over a little weird, but that's where they are. And yeah, that is my presentation. Thank you very much. This was a very fun class, and I look forward to hearing from you again. Thanks.